Hi, I'm Lynn Golovic. I'm the nursing team leader for 6th floor orthopedics. Most of our patients go to 6 North, which there's 22 all private rooms on 6 North. And then we do have some patients that come over here onto 6 Zone 1. There's 6 more private rooms over here for orthopedic patients too. Judy Haynes, my nurse manager, and myself, we do oversee both sides. So just let you start off with that. Okay. When you come in for the morning of your surgery, you're going to go to room 160. 160 is also the surgical waiting room where you may have been already. It's on the 1st floor. When you enter the hospital, you're on the ground floor, so this is going to be on the 1st floor. You can take the escalator or the elevator up to 1, and it's going to be all the way down at the end of the hall, room 160. That's the surgical waiting room. When you come the morning of your surgery, you just need to bring with you picture ID and your insurance card. They will take the patient in the back, get you set up, and family members can wait in the waiting room. You're going to get an ID number to follow the progress of your loved one on a big screen TV. Once a patient's set in the back in a gown, they usually let the family come back in. They call it minimal separation. They do want they want you to be comfortable, and normally most of the time you're comfortable with your family around. At that point, you're going to meet your surgical nurse, the anesthesiologist, and also your surgeon. He's going to come and talk to you and confirm what is he doing, left shoulder, right shoulder, and he's going to take a Sharpie and label what he's doing for you. He's going to let you know at that point, too, how long it's going to be. He knows how long he's got slotted for you, whether it's going to be 2 hours, 3 hours. He'll let you and your family know at that point how long it's going to be. What we ask you is that in that time frame that you come back to 160 to talk to the doctor post-operatively. He'll let you know how everything went, and then usually within a little while they let you go back in with your family again to see the patient. Once your room is all set and on the floor and you're ready to come up, we will get report on the floor from your nurse taking care of you in the recovery room, and then you will be transported up here. You'll arrive to the 6th floor, and your assigned nurse on the floor will do a full head-to-toe assessment, concentrating on that shoulder that you've had done. A lot of times the doctors will use a block, so you're not really going to be feeling much of anything, but we will do an assessment on you, make sure that you can feel your fingers, your hand, take a look at your wound. And then usually what we do is reposition you in the sling. When therapy comes, we will show you how to put the sling on. And reposition you at that point. Usually when you arrive to the floor, patients normally want to get up right away because you're really kind of sick of being down, and we'll help you with that. We assist you to the bathroom, we'll get you up in the chair, and make sure that you're comfortable put in the position that we can put you in. Okay? When you're here in the hospital, you're going to be getting 3 doses of IV antibiotics. The first one you get in the recovery room, and the next 2 you get on the floor. You're going to be getting some type of an anticoagulant, and usually for shoulders they just use a high-dose aspirin, but you'll be getting that while you're here too. You'll see inside of your chart there is some information on healthcare proxy and Meals on Wheels. We do encourage you to have a healthcare proxy, so if you don't have one, fill one out. You can take this one home with you and complete it at home, decide who you want to be your proxy, and you can bring it back in with you the morning of your surgery. The signature line has to be witnessed by 2 people who cannot be yourself or your proxy. So if you don't have 2 more people at home to witness it, you can just bring it in unsigned, and 2 people in 160 will witness it for you. There's also some information for Meals on Wheels. Some people need a little bit of assistance post-operatively with meals. You will be going home. Most every shoulder goes home. Every so often we have one that for some reason they're not able to, but most shoulders do go home, and they do go home on post-op day 1, which would be the day after surgery. You just spend 1 night with us. When you're here too, we do purposeful nurse rounding from 6 a.m. to 10 p.m. Every hour, someone from the staff is in to see you. During the night, it's every 2 hours. We just don't want you to sleep through pain medication though. So if you're due for something, make sure that you talk to your nurse about getting your pain medication when it is due. Okay? You're gonna wake up with some type of a compression stocking on. It's usually TED stockings and a foot pump. And this hooks to a machine that sits at the bottom of your bed and it instills air to promote circulation. It's usually just the foot pump, but every so often somebody does have the full leg pump on too. This goes around your calf. Again, hooks up to that machine at the bottom of your bed. Sometimes with shoulders, you will wake up too with a hemovac. This is a drain that is put in during surgery right into the joint space, and it's to collect the extra blood and body fluid from around that joint space and prevent swelling. This is drained every shift. We monitor the output, nursing staff does, and normally the physicians do remove this the morning after surgery. A lot of the docs have been going to an Aqua cell dressing. This is a waterproof dressing that goes on your incision site so that you are able to shower right away post-operatively. A lot of people do like to shower before they leave here.